Are you currently suffering from hip pain and have the feeling of tightness or instability around that joint? These are common symptoms of hip dysplasia where the socket on your hip joint is shallow. And unfortunately, this goes often misdiagnosed or undiagnosed for far longer than it should, and people suffer unnecessarily. For those who don't know me, my name is Dr. Zach Grewitt here at Performance Sport and Spine, and in this video I'm going to show you how to resolve this condition without using any pills or requiring surgery. If we look at the model right here, this is our femur or thigh bone, and then this is the pelvis or the socket, and this is the joint we're talking about. And you can see from this model, this socket covers almost all of the ball, so it's stable and strong. Well, people with hip dysplasia, that socket is much more narrow and does not cover the ball as much, which puts excess stress onto the muscles, ligaments, and labrum around it. It can also make people more likely to have dislocations or subluxations of that hip joint. If you please like the video, subscribe to our channel, and then click on notifications. With hip dysplasia, we're going to talk about babies and then adults and teenagers. So with babies, this affects about 1 to 1.5% of all babies. And some common signs are if one leg is longer, when they start to walk, do they have a limp? And when you put on the diaper, does one hip just move a lot more than the other? How this commonly presents in adults and teenagers is there's going to be hip pain, there's going to be this feeling of instability or kind of uneasiness of that hip joint. When you compare it to the other side, there's a lot more range of motion, especially in rotation and abduction, or lifting your leg away from midline. It's most commonly found in females of Caucasian descent, and there's a family history. So if your parents have it, you're much more likely for yourself to have it. What causes hip dysplasia? And unfortunately with this condition, there's a lot of mis and disinformation about what causes it. So the biggest thing is breech position. And this is when you're a baby, instead of your head facing down, your feet are facing down. And 30 to 50% of all people that have hip dysplasia are born in this position. Number 2 is that family history we were talking about. If your parents have it, you're 12 times more likely to have it yourself. Swaddling, and this is where you wrap the baby around, and in some places they do it very tightly and excessively, especially when the hips are abducted and flexed, as we show you here. This can cause hip dysplasia. And then lastly, there's this hormonal theory of this imbalance between estrogen and progesterone can be a risk factor. For proper development of this hip joint, the ball needs to be staying inside the socket. And sometimes with people with hip dysplasia, as they grow up, this ball is out of the socket, and that can cause issues. As well as this socket, there's 3 bones that comprise it, and they need to grow uniformly to cover the socket properly. And with this, the first thing again is early detection and accurate diagnosis, but the second thing that I see is stop stretching it. Again, that hip is shallow, and there's already excess stress on those muscles and other tissues. And again, humans are kind of ingrained that if it's tight, I should stretch it. And again, you're going to find that it feels better for 30 minutes afterwards. But again, when you're doing these stretches that we show you here, you're placing excess stress on the labrums and other tissues, and you can actually cause long-term damage and even dislocations if you do it hard enough. So again, exercise is the course here, not stretching. Kneeling hip abduction. On your hands and knees with the bound above your knees, with your knee bent at 90, press your leg out as far as you can, back out at 45, and return to the starting position. You should feel tension over the outside glute muscle and hip. So this is a standing banded exercise. We're going to put the band around our feet with our hands on our hips, and then we're going to push our leg outwards in a lateral position, balancing on your stance leg. You should feel tension over your hip, and again, try to keep the balance on that leg as much as you can with the muscles, and don't shift your weight over. With the band in that same position, we're going to be against the wall in case we need stability, and then we're going to lift our leg up as high as we can, feel tension in the front of that hip, and then back down. Again, only go part way at first until you feel more comfortable, and then as you get stronger and you feel more confident, you can bring your leg up as high as you can, and then back down to the starting position. Standing hip extension. So with the band in the same place and your hands on the wall, we're going to press one leg back, feeling our hamstring and our glute, and then return to the starting position. Again, press back as far as you feel comfortable, but you want to feel tension here and not in your upper back. The level 2 exercises are requiring an exercise ball. There's a clickable link if you want to buy it online. So placing the ball on the ground, we're going to stand with our hands on our hips, and then we're going to press out laterally, slow and controlled, and then come back. Again, we're trying to build stability and strength in this horizontal or lateral plane, and again, kind of decrease the depth and range at first, and at time, build up stability and improve range of motion. Next one is going to be a ball lunge. So we're going to put the leg up on the ball, and then we're going to lunge down, pressing our weight backwards, and then stand up. Again, try to build that range of motion over time. And one thing you really want to do is try to keep your torso vertical. So we're loading the hip we're not just bending the back. So you want to feel tension here and here, not here. So again, press back, slow and controlled, and then stand up straight. This next exercise is going to require a PT band or a rope, and we're going to put one leg against the wall firmly, and then we're going to take this band and gently pull out. While maintaining that, we're going to rotate through that stance hip up as high as you can and down. So we want to feel tension here. And again, you're not rotating your shoulders, you're pulling apart and then rotating through the hip and then come back. With this, it's challenging, so don't try to go all the way at first, but build control and then increase the range of motion as you feel more confident and you get more strong through that range of motion. And lastly, we're going to show you some helpful diagnostic criteria and what imaging is best for both babies and adults. For babies, ultrasound is preferred in its Ortolani test and Barlow maneuver. For older children, ultrasound is again preferred, and there's examination of the skin folds and discrepancies of the leg length. One leg may be longer than the other. For adults, x-rays are the preferred choice, and there's 3 lines to be aware of: Shelton's line, Hill-Grinner's line, and Perkins' line. Thank you so much for watching our video on hip dysplasia. We hope this brings some awareness and evidence-based way to diagnose this and then way to rehab it. Because again, a lot of people get the wrong information about this. If you did find this video helpful, please like the video, subscribe to our channel, and then don't forget to check out our other videos.